if we look at where the money is spent, we've seen that most of the money for these patients is spent in inpatient settings. Outpatients is also a large category, and drugs account for about 20% of healthcare spending for these high-cost patients. Interestingly, if we look at, for example, the average number of inpatient days, we see large differences, with the US having on average fewer inpatient days than the other countries, and Germany having a lot more. This tells us that it's not only a question of utilization, but there are large price differences as well. Until now, we've been talking about the average high-cost patients, but we all know that the average patient doesn't exist. And so one of the things where we see that is that the spending pattern of these patients changes as they age. For example, in the Netherlands, you see that in the infants and neonates, there's a very large dark blue bar, and that is hospital and outpatient spending. That dark blue drops in later ages, children and adolescents, and then increases again in the elderly. The grayish blue bar, which you see in the middle, that's mental health care spending, which is one of the most important pockets of spending in the Netherlands in adolescents and young adults. And on the light blue is the spending on drugs. In other countries, we see that these spending patterns differ a bit. So this is the Netherlands again. If we look at Germany, you see that the pattern is roughly similar, just that the spending on drugs is a larger share of the spending at every age group. And then in the USA, the pattern is not so clear, but we see a bit more rehabilitation and post-acute care. That's the darker blue, specifically in the elderly.